I joined my dad in practice, who had been in practice here in Houston, Texas for almost 20 years, delivering healthcare the way that you would want healthcare delivered to you or to a family member in a consistent, coordinated, and personal way. And what we found that more and more healthcare dollars were going to people who did things to people instead of to doctors who did things for people. We went into primary care because we want to do things for the patients we take care of and for their families. We started to see an opportunity for primary care doctors to get paid for outcomes instead of just for procedures. We call that now value-based care, but it's just a different name for effectively the care that we were delivering back in the 80s and 70s when my dad first went into practice. As we moved through the years, it started to get more and more complicated. And to be successful in delivering quality care required data and analytics and care teams and resources that most people just didn't have access to or just weren't available to the typical primary care doctor. Too often, doctors were being faced with a choice to either accept an employer that they weren't happy with, to leave practice earlier than they should, or move into a business model that restricted patients' access to them. None of those options felt like the best kind of option for me as a physician or for the patients that I take care of. When we looked around our practice, we realized how fortunate we were. We'd built a practice that had great name recognition in our community, had physicians who had been with us for a long time that were happy in the way that they delivered healthcare, and employees that enjoyed the work environment and stayed for really long periods of time. What we wanted to do at VillageMD is we wanted to take all the resources, strategies, tools, and techniques that we had developed here in Houston to the independent physician. Every day I get out of bed knowing one thing, and that one thing is that without a physician's voice at the center of every table where decisions are being made in this healthcare system, decisions may not be made in the best interest of our patients. We've been asked to advocate for both our patients' health and our patients' healthcare dollar. And there's nobody in the healthcare system that is more trained, skilled, or has relationships with a patient to be able to do that. VillageMD delivers the tools, the teams, and the strategies for primary care physicians to deliver the type of care that they want to the patients in the way that a patient wants it. We support physicians in bringing both the best of the old and the best of the new together so that patients and doctors have relationships that last a lifetime. That's why we went into primary care, that's why we stay in primary care, and that's what we're obligated to do for the patients that we take care of.